Good afternoon and welcome everyone to the American Lung Association's Community Connections presented by Novant Health. I'm your host today, a member of the Novant Health communications team. My name is Gina DePietro, and just a few housekeeping items before we begin. This webinar is being recorded and will be available after the session. We thank everyone who submitted questions in advance of this presentation. We received a lot of great questions and we'll do our best to answer all of them towards the end of the session. We also encourage everyone to complete the survey following this presentation. That will certainly help guide us as we create future sessions. Today's discussion, as you know, will focus on the COVID-19 vaccines and vaccine hesitancy. We understand that many people may be reluctant to get the vaccine. In fact, daily national surveys by Carnegie Mellon University show that although COVID-19 vaccine uptake has increased, the proportion of vaccine hesitant adults has remained unchanged at 23%. Now, the reasons vary from adverse effects, misinformation, historical events, and even cultural experiences. Our presentation today will explore concerns, answer questions, and start a conversation about general immunization and the COVID-19 vaccines so that you can make an informed decision. Now I'll introduce our esteemed speakers for today's program. Dr. Jerome Williams Jr. is a cardiologist and Senior Vice President of Consumer Engagement and Corporate Health for Novant Health. He is an experienced physician executive with over 20 years of leadership experience as Medical Director of Research, Chairman and Chief of Cardiology, Vice Chairman for the Novant Health Accountable Care Organization, Physician Executive of Novant Health Value-Based Business Unit, and board member of the Novant Health Medicare Share Savings Program. He also serves as co-chair of the Mecklenburg County COVID-19 Recovery and Renewal Task Force. Since we have two Dr. Williams on today's panel, Dr. Williams will refer to you as Dr. Jerome. Dr. Brooke Williams is a board-certified internal medicine physician, currently practicing as a hospitalist at Novant Health in Winston-Salem, North Carolina. She completed her residency training in the south suburbs of Chicago. During her residency, she co-founded a nonprofit with colleague Desiree Leach, PhD, called Color of Medicine. Through Color of Medicine, Dr. Williams strives to increase underrepresented minorities in both medicine and STEM. She is an advocate for increasing culture competency and reducing racial health disparities within the minority community. And again, since we have two Dr. Williams on the panel today, Dr. Williams, we will refer to you as Dr. Brooke. Also joining us today is Sharice Johnson, the Executive Director of the Camino Community Center. She is a Puerto Rican Bronx native Latina. She has over 25 years of leadership experience in healthcare, has 17 years of nonprofit leadership experience, and has 8 years of managed care experience. And rounding out our panelist for today is Felicia Fuller. She is the Director of Health Promotions for the American Lung Association in Illinois and Wisconsin. And she plays a central role in the development and coordination of Lung Association mission activities, including health promotion, lung health education, and advocacy. Felicia is also a member of the American Lung Association's Diversity, Equity, and Inclusion Council. So we're going to begin with Dr. Jerome today. And Dr. Jerome, if you could tell us about the development of the COVID-19 vaccines and the FDA emergency use authorization, since some are concerned about the speed at which some of these vaccines came to market.
Absolutely, Gina, and thank you, American Lung Association, for hosting this webinar and forum to bring fact-based information to your constituency. So, you know, that's a great question about the development of the vaccine, and I like to usually break it down into four main buckets, all right? And those four main buckets include the fact that there was already research to build on as it relates to developing the COVID-19 vaccine. The vaccine technology already existed. Administrative and logistic hurdles were moved out of the way, meaning there was no shortcuts that were taken from the scientific standpoint, but the administrative burden was reduced, and resources and money really drove the expedited process for developing the vaccine. So first of all, when we talk about the research that had already been accomplished, if we think about it, and if we look back in the not too distant memories, our country and the world were exposed to SARS virus, was also exposed to the MERS virus. And as such, there was a number of scientific organizations and institutions that already began to look at those types of viruses. So the COVID-19 or the virus that causes COVID-19 is actually a SARS virus. And so there was a lot of information on SARS virus. In addition, during those prior outbreaks of SARS and MERS and Ebola over the years, a coalition was formed, a coalition called a Coalition for Epidemic Preparedness Innovation. This was formed in 2015, and that coalition is a global partnership of public, private, and philanthropic, as well as societal organizations that work to accelerate the development of vaccines against emerging infections. So the process really started a number of years ago because there was concern about a potential pandemic across the world. Now, when we look at the technology used to develop the vaccine, specifically Moderna and Pfizer, they used mRNA technology. And that mRNA technology really had been in existence for a number of years. The scientific community had been researching mRNA technology as well as its use in vaccines. And quite frankly, Moderna had been strictly working in the mRNA development space for years. So from a technology perspective, they were able to really accelerate the development of the vaccine. Interestingly, back in January 2020, right before COVID really hit the United States, the genomic sequence of the COVID virus was already sequenced and put on the internet. And so researchers all across the world had an opportunity to begin to work on not just vaccines, but learning more about the virus. Let's turn our attention to a lot of the administrative hurdles that were moved out of the way. To conduct a clinical trial, it usually takes anywhere from a couple of months to a year. There are submissions of data and information, answering questions to regulatory bodies and regulatory agencies, and all of this occurs before a trial usually begins. And so what occurred as a collaborative across the world is that regulatory agencies came together to prioritize COVID studies. So they put other studies potentially on the back burner. They put more resources to personnel in the administrative arm for reviewing the data. And so that really expedited the review of the data that was coming out. What was instituted was also called rolling reviews. Rolling reviews means that as the data is coming off of platforms, it is going to regulatory bodies for evaluation and for study. Typically, all the data is gathered throughout a trial, and at the end of the trial is presented for regulatory review. However, in a rolling review fashion, this was ongoing. And lastly, money and resources. It is very expensive to conduct a clinical trial. And so governments and institutions pour a significant amount of money and resources into development of the vaccine, into the administrative process in order to expedite the development of the vaccine. Because we are in a pandemic, the prevalence of COVID-19 was widespread. So there was really a number of folks readily available and eager to enroll in these clinical trials. When you have an illness that only affects a small number of people, it takes a long time, years, to get folks to enroll in clinical trials. However, because the prevalence of COVID-19 was so broad, we were able to get a number of people in a very short period of time to enroll in these trials. And as a result of that, the statistical difference between the control group or the placebo arm versus the vaccine arm quickly showed that those in the placebo arm, it was an inferior strategy, and that the vaccine was really working. So those are the reasons why that the vaccine really came out in such a very quick and unprecedented time frame. Now, you also mentioned emergency use authorization. So emergency use authorization is really just a mechanism to facilitate the availability and use of different countermeasures, such as vaccines or medicines or therapies that are not readily available. So emergency use authorization does not cut corners from the scientific standpoint, but readily makes available those therapies that show that the benefit of using the therapy far outweighs the risks of the therapy.
We know right now in the United States that there are 3 COVID-19 vaccines approved for use. Do you expect that any more might be approved, perhaps the AstraZeneca vaccine?
So, as I mentioned earlier, the process of delivering a vaccine, medicine, or any other type of medical therapy goes through a very rigorous process that the FDA has outlined, and it's a very well codified process. And as a result, the AstraZeneca vaccine, which is already approved in the United Kingdom, has not really met the criteria for approval, even emergency use authorization in the United States. So I don't know when that will occur, and it doesn't appear at this time that there are any other vaccines on the horizon that would be readily available for use. But we do have plenty of Moderna, Pfizer, as well as Johnson & Johnson vaccines out there to vaccinate our public.
And can you talk a little bit about this concept of herd immunity and what exactly that means once we reach that?
Yeah. So herd immunity is a term that we use to describe the slowing of disease spread that occurs when, and this is the key piece of it, when a significant portion of the population has been vaccinated or immune to an infectious disease. And typically, when about 80% or so of the population has been vaccinated or immune to an infectious disease, we achieve our herd immunity, which effectively means that the spread of a particular disease is limited and is under control. And so we're still a ways off in terms of the number of individuals across our country that's fully vaccinated. And so we're really striving to get to herd immunity very quickly so that it reduces the chances of variants and mutations forming.
Dr. Jerome, thank you. Moving now to Dr. Brooke. Many people are hesitant to get the vaccine due to adverse effects, historical events, or even political reasons in some cases. Can you speak about the concern regarding vaccine side effects, especially in light of that J&J distribution pause that we saw get lifted recently?
Absolutely. Thank you again for the American Lung Association again for having us today. Specifically with some of the adverse reactions that you can experience with any vaccination, right? So, you are having an injection and needles going into your arm. You can definitely have some arm tenderness, some redness, especially with the COVID vaccines. And after the second injection specifically, some of your symptoms may seem to worsen, things like fevers, chills, headaches. And of course, we can't avoid the elephant in the room with Johnson & Johnson previously being taken off the market because of concern of blood clots that are developed within certain patients. But just to kind of reiterate, this is a very, very small number of people. And in light of developing the rare reaction of having the blood clot, it is still definitely pushed to get your COVID vaccine. And with the Johnson & Johnson reaction with the blood clot, it was specifically seen with women within the ages of 18 to about 50 or so. And even if that's the case if you're having some concern of having that reaction, rightfully so. There are also two other vaccines that you can most definitely receive. So again, it's still the risk benefit of not receiving the vaccine versus some of these, possible rare side effects that you may develop. It's still very good to, reach out to your primary care doctor if you have any questions, but definitely like Dr. Jerome mentioned, we're trying to reach herd immunity. So trying to get as many people vaccinated as possible is the goal.
I know this is rare, but people are concerned about those who have gotten COVID-19 after vaccination. Can you explain why this happens in some cases?
No, absolutely. So as of actually April 21st, the CDC released there's about 7,100 patients now who have contracted or have tested positive for COVID after receiving the vaccine. And like Dr. Jerome mentioned, that the vaccines are not 100% efficacious, so cannot 100% guarantee that you may not contract COVID. And that's why we're still honing in on, we still have to practice, safety. We're washing our hands, making sure we're practicing social distancing. I know the CDC also just recently released that it is okay for fully vaccinated people to gather outside without a mask, but you still have to take that in consideration of being around people who may have high risk of still contracting COVID, and people who have underlying illnesses. You still have to be very careful. And the fact too is that the vaccines do not cover every variant that is out there. So, we cannot say 100% after you've received your second dose of vaccine, whether that be Moderna or Pfizer, or the one-time dose of Johnson & Johnson, that you can 100% be guaranteed to not contract COVID. And we still don't really know how long that the vaccines last when we'll need a booster. So ongoing research is still being conducted, but it can happen. It's not 100% guarantee.
And I know you alluded to in one of your earlier answers, those blood clots. There have been just a few instances where people have died after receiving the vaccine. Is there any group of people who should not get it?
So unless you've had a anaphylaxis, meaning a life-threatening condition after receiving, any vaccine, there are also other components within the Moderna and Pfizer vaccine. It's a certain type of alcohol component. And again, I kind of defer that to you. Definitely, if you're having a concern or having some type of severe allergy, to seek out and talk to your primary care doctor to make sure that the vaccine that you are thinking about receiving is right for you. Again, any type of medication that we ingest in our bodies all have side effects, but for the majority population, the vaccines have been studied amongst many races. People have different diseases and has seemed to be safe enough to enter into the majority of the governing body population.
And lastly, are there any barriers or challenges that you're aware of in the Winston-Salem area delaying people from getting the vaccine?
Yeah, so Novant has done an excellent job, and I know other healthcare systems providing access to the vaccine. So physical barriers, there are plenty of sites that you can go and receive your vaccine. Now, they're actually being introduced in some of the pharmacies. But as far as some hindrances, of course, with, our topic is vaccine hesitancy. So just being hesitant about receiving the vaccine definitely can cause some hindrance amongst the population. So anything that you have concerns, please reach out to anyone that you trust, specifically, your healthcare provider. We are being very transparent and even sharing our own personal experiences with receiving the vaccine. So I can't reiterate more enough to really any questions, concerns that you or family member you may have heard on the news, or there's so much information being overloaded to everyone daily. Please reach out so we can try to explain some of the things you may have heard, and maybe kind of add a little bit more of a specific more of a realization of not trying to, try not to go along with just the headline and being more, giving a little bit more data behind why, certain things are put out there.
Definitely want to be aware of misinformation. We know that hesitancy is often based on cultural experiences and historical events. Felicia, can you address those historical events, particularly in the Black community, that impact people's decision-making today about vaccinations?
Sure, Gina. As I was thinking about this question, we can go back to when the first Africans were brought to the United States and were slaves. There's through slavery, through Jim Crow, there's always been Black people were seen as second-class citizens, if citizens at all, were not provided care when they needed care, when people knew about care. But I think the main atrocity of this, a health atrocity of this country was the Tuskegee syphilis study. And if I could just speak on that a little bit, it occurred to me when I discussed this topic with my two older sons, they were like, they didn't know what Tuskegee was, and they thought it was a school their friends went to. Well, sure it is, but this is where this particular study took place under the guidance of the Public Health Service, the Public Health Service being under CDC. The study took place from 1932 to 1972. That's astonishing in and of itself. You have to remember that in 1947, penicillin was recognized as the treatment for syphilis. However, this study continued. They were looking specifically at what happened in untreated individuals with syphilis. They happened to be, the targets or the subjects were African-American men. They were poor, they were sharecroppers, they were farmers. They signed up believing they were going to get free medical care, which they did, but they also were not provided care for syphilis as time went on. Many of them died. There were 400 in the study that had syphilis, and there was even a control. So the study was done correctly with 200 of them being a control. Complete atrocity. Many of us may know descendants of these men. Many of us, some people were married, they went with wives, girlfriends, children. Many of them were found with syphilis as time went on. So this is it's a stain, not just for the Black community to ingest as a trauma, but for like I said, for the entire country. Due to that, today, federally supported studies, that include any human beings, are reviewed by what we call institutional review boards. These are IRBs. And if you've ever done any research like I have, you have to make out an extensive amount of forms just to be okayed to have human subjects. The IRB is set up under the Office for Human Research Protections, which is under the HHS, Health and Human Services, which was specifically made because of this particular study, this particular part of our government. So these were all done in the 70s when this study was shut down by a whistleblower in the Public Health Service. And it was made so that this would never happen again. All subjects today have to sign a consent. So all of these things are protocols and things that were put in place so that we can trust the effects of research and this research is done by. President Clinton definitely apologized for this atrocity in 1997, calling it a deeply, profoundly, and morally wrong time of our history. So yes, these are things that are historically in people's minds. They do affect how we access or get care, but we need to know that protocols are in place. The government has definitely changed. These are things that do not happen anymore and that we can look at and learn.
And what other barriers does the Black community face when it comes to getting the COVID-19 vaccine?
Well, just like any other communities, when you have things like that in your mind, but there's access to information, there's access to transportation. Today, the current Biden administration has made it so that 90% of us should be within 5 miles of a place that we can go get a free vaccination. And that might be well and good, but 5 miles can be a very long ways in rural populations, and a mile can be a long ways to go in an urban population. If there's no buses, if there's no childcare, if there's no access to getting someplace, my car doesn't work. So transportation still is a barrier. Today, unlike the first SARS that Dr. Jerome mentioned when he was speaking, you could just walk in. I remember getting my SARS shot, that H1N1 shot, and you could just walk in and we could get the shot. I took my kids, we just, no type of internet thing, you know, you walked in and got your shot. Today, we have set up this system of going online, checking in, getting an appointment. And I know for my parents, that was definitely a barrier. I've heard through other people that's a barrier. So that we're still kind of working our way through that. In public health, we want to make sure that everyone has access, and that's definitely an area that we need to work on, is just people being able to come in and get their shot. I think lastly, we may have an evidence-based information. We're lacking in that area. We have to continue to put out evidence-based information regarding this in ways that people can understand and in their communities, and starting where they are. Sure, it's great that it's on TV and public health announcements and things like that, but we also have to provide information that combats sometimes information that's in social media that's true, evidence-based, and a way that people can understand, so they know that this is something that they should go get.
Certainly important to meet people where they are. I'm curious, Felicia, what is the most significant thing, in your opinion, that's changed attitudes about getting the vaccine in the Black community?
Here at, I don't know if we mentioned that I'm on our vaccine task force, and we've had we facilitated a community kind of group of people giving their ideas about things, and it was very diverse in people of color, and especially the Black community. It was found that if somebody else has it, somebody that I know, that everybody knows, a celebrity. So of course we start with celebrities. That's somebody I know that got the vaccine. But even to break it down a little bit more community level, did my pastor get it? Did my teachers get it? I know at my son's high school, all of his teachers were offered the vaccine. So for him, that kind of strikes a chord. I think people of color, or the African-American community, is looking for other family members, people, community leaders, the mayor, people you can relate to. Did they get it? Are they fine? Are they still, going on with their daily activities and working and being productive human beings? So I think that's a big part of it, is us seeing us getting the vaccine, us seeing us, and we're totally okay. Nothing's wrong. And we're kind of going on with our lives.
And moving now to Charisse, what barriers exist for the Latino community and others that you serve?
Hey, Gina. Yeah, thank you for having me here. So some barriers that exist prior to COVID, right, which included the lack of culturally sensitive, affordable, quality healthcare in general, and COVID just made that come to the forefront. So Latinos are also faced every day with the external stigmas that exist about people that are undocumented. We face with cultural norms within our own communities that do not embrace seeking help. For most, it's more of a shame culture. We've interviewed people that said that they had little to no doubt about getting vaccinated. However, they did acknowledge how other Latinos were afraid of getting vaccinated for various reasons. A lot from misinformation that's circulating on social media to uncertainty of long-term side effects due to the rapid development of the vaccine. There's language and cultural barriers specific to comprehension of the questions. The registration is in the form of a link online that a person has to go to, fill out all the demographic information and questions, pick a date and time, and then they get knocked out only to have to do it 7 more times before they get an actual appointment. And then you have them doing that in not your native language, nor understanding what the questions are asking you. Lack of education in Spanish, while those that are in charge of the education, they're trying, but they're missing the Latino market by not using the media outlets that the Latino use. Lack of trusted medical professionals to ask questions about their specific medical conditions or concerns, right? Most of us have a PCP that we can ask questions to. A lot of the Latinos do not. They are using these health clinics, they're using ER urgent cares, and so they don't have anybody to ask these questions to. There's also a lack, like Felicia said, the lack of influential people that look like me and speak Spanish coming forward to assure them that it's okay, nothing has happened to me, I'm good. And also the lack of lay people to help navigate what is already difficult to navigate for those that speak English and those that are born and raised here. So imagine you're coming from a foreign land and you don't speak the language and you don't understand the culture. In the Central American and those countries, you know, a lot of the larger hospital systems are ran by the government. And so when we have our beautiful atriums and our Novants here that are doing all of these vaccine clinics, we are seeing them as governmental agencies or governmental institutions. And so then you have that fear.
And how have centers like Camino Community Center been addressing some of those challenges you mentioned?
Yeah, so first of all, we wanted to ensure that we had qualitative data from our community on what they believe to be the challenges. Oftentimes data may exist that's missing the voice of our Latino immigrant population because of the fear that exists by participating in these sorts of information gathering activities. So we actually completed our own research survey. We have a research and evaluation team at Camino, and we were able to get at least 20% of self-reported, not undocumented people to actually respond to the survey, which was very helpful. So according to our research, it was not the lack of smartphones or computers or transportation as we originally had been told. It was a lack of trust. Because of the lack of education and because of the fear that exists being undocumented. So the number one thing we did was we contacted first the Mecklenburg Health Department to secure vaccines, and they were more than willing to partner with us. They were responsible for actually securing the vaccine. And then we were responsible for the administration. We have a clinic here, and so we used our own providers that are here that actually administer to vaccine. We started to call all of our clinic patients that were 65 and older, that group 1 when it first started, and their providers that were seeing them actually called them and provided education and offered the opportunity for the vaccine and offered the time. We had all of our FNPs calling and our docs calling our patients and spending quite a bit of time just answering basic questions. So if I have diabetes, what is going to be the long-term results and all those and did one-on-one consultation. We have a team of volunteers that come and they actually work here when we did the vaccine clinics that were helping out, filling out the paperwork. Met County was wonderful in truncating that information that they had to get. We require no ID, no police for crowd control, right? We wanted to make this as easy as possible for them to get their vaccine, get education, and come back for the second vaccine. We also have a community of over 200 faith-based leaders that we connected to start calling their congregation and be those people that are actually those influential people that look like them and start having conversation and connect them to Camino. We partner with Norson Media, which operates 25 local Spanish language radio stations. And so we're getting people with the media outlets that they use, right? And not what we think. So where we're using maybe the Charlotte Observer or those type of things, I use that just as an example, we're using the WhatsApp app, right? Because that's what Latinos use. We're using Hola, we're using La Noticia and those type of media outlets to make sure that we are addressing and getting the people that we're trying to serve. So we vaccinated over about 530 people. We had 100% of our appointments kept, and we have continued to have a wait list. We continue to partner with the health department, but have expanded our partnerships to include Walmart and the local pharmacies. Randolph Pharmacy just partnered with us. We have other people that are calling us. And then lastly, we're providing information about our services. So they're not just coming here to get the vaccine, they're also being given the opportunity to come and get services here. Well, we provide primary care, behavioral health, integrated care, food pantry, a health and wellness program called Camino Vida, and we're just Latinos serving Latinos.
You mentioned a lot of those partners that you work with. Who else in the Latino community might you mention that's helped to dispel concerns about vaccination, perhaps other trusted community leaders?
So who we're working with, I'm not sure about influential leaders, but we're working with the pastors and the faith-based leaders. That seems to be where we're getting most of the traction from, as well as these corporate sponsors like people from Compare, Bravo, supermarkets, Stefan Latore, who is a well-known lawyer that works in immigration law. So those are the people that we are partnered with. And then the corporate sponsorships like Walmart and everything that are coming here. And so they're all working in their ways of dispelling and providing education, right? Because our ultimate goal is to provide education to allow someone to make an informed decision about whether they should get the vaccine or not.
Sure. Thank you, Charisse. And
Thank
Felicia,
you.
I'd like to go back to you. What are some of the ways that the Lung Association is working to address this vaccine hesitancy and some of the barriers within the Black and Latino communities?
So I'm very proud of our website. We can start right there. You can go to lung.org/COVID, and it will take you to a host of different educational services or links to the CDC, links to places you need to be, lots of information, and specifically around the vaccine. So we have, as an organization, partnered nationally with the Conference of National Black Churches, where we're doing work to find out ways that we can reach pastors and get into the community level of the Black community. But we also have partnered with the Center for Black Health and Equity, which is in North Carolina, who has partnered with us in putting together these, what we're calling our COVID-19 toolkits, the Better For It series. Please go to lung.org and put in COVID and look at one of these. We have one that is our first one that I was really proud of, was our one that was geared toward the African-American, the Black community. Very well done. I'd say about 10 pages through, but you can look through it, download it, print it out, give it to your friends, send it electronically. And it has trusted leaders from Dr. Fauci, AOC, other doctors, other celebrities, as well as, again, community leaders giving their perspective, and just really information like Dr. Jerome gave regarding mRNA and its place, and the background of information regarding how the vaccine was made. So it's very well done. I definitely encourage people to find that. We also have one in Spanish, and it's not just the Black one in Spanish. It's very catered to and targeted to the Spanish-speaking community. That is there. We have one that's also a toolkit that's targeting Native Americans, and one that's targeting the general public. So these are all very well done. And of course, you can download, pick out one page and print it out and give it to your friends or send it out. This is something we're very proud of. I think it really addresses the information in a succinct way. And it's not necessarily something that's saying, hey, go get vaccinated. I believe these are informational or public health messaging and communication that says, here's the information. Now you know it. Now you can make an educated decision. So that's something specific we're doing. We have a number of podcasts that are geared again to the general public, but also to specific populations like the African-American community or the Spanish-speaking community. So just kind of tooling around on our website, or if they want to get in touch with me, I can send them direct links. Those are something that the ALA is doing and is providing to the public to educate and provide evidence-based information for your decisions around vaccination.
That's fantastic. Thank you, Felicia. This has been a great dialogue. It's time now to address our viewer submitted questions, and we'll do our best to get to all of them. I know Jennifer just submitted one live, and Dr. Jerome, I believe this one is for you. But what are the recommendations for people who have had COVID-19? Should they get the vaccine?
Absolutely. At this point in time, for those who had COVID, it's really unknown what type of immunity they have against COVID. And so if those who are usually it's about 7 days out from COVID, they should be eligible to receive the vaccine.
And since they've only just been recently developed, Dr. Jerome, how will we know the length of protection that the vaccines provide?
So actually, very recently, last few weeks, Pfizer and Moderna put out a report that at 6 months, folks still have significant immunity against COVID-19. Now, let's not forget that the research trials, the information gathering is still ongoing, right? So we're still following all of those individuals who participated in the original trials, and we continue to follow them out for a few more years to continue to gather more information. So as of right now, we know there's folks are still protected as of 6 months. And as we continue to move further out, we'll continue to monitor to see how long the immunity will last.
Sure. And two viewers previously submitted questions, both Davida and Steve, asking about this idea of this booster shot, another shot that people may need to get. Are you able to explain sort of how likely that is and when people may need to get that, if they do?
Yeah, some of the data that's coming out and some of the information reported suggests that somewhere between maybe 12 months out from the your second shot, if you're using Moderna and Pfizer, there may be a need for a booster shot. It hasn't been recommended just yet. However, they are preparing for it, similar to other booster shots for other infectious illnesses. And the reason for that is, as we continue to move through this pandemic, especially since we've not reached herd immunity, variants do come up, right? The immune response can wane over time. And so there is often a need for a booster shot. So to be very direct, no, there's not been any formal recommendations about a booster shot. However, all the data is probably going to come out and suggest that somewhere after 12 months, a booster shot may be indicated.
Dr. Jerome, thank you. Dr. Brooke, these next questions are for you. David wants to know, how effective are the vaccines for people who are on immunosuppressant drugs? For example, should people with chronic lung diseases or lung cancer get the vaccine?
No, absolutely. That's a great question. Definitely, people in that risk group have not been removed from being able to receive that vaccine. As far as, again, there was a question about how likely are you able to contract COVID after receiving the vaccine. I think that's where you have to kind of question that, because again, you're already at risk. Your immune system is already compromised for being on certain medications. So you definitely want to take the proper precautions. Although you've received both vaccines, definitely still wear your mask, still practice social distancing. And, to make sure that if you start to have any symptoms, to seek out for medical treatment immediately.
And Dr. Brooke, Dawn, another viewer, she submitted a question saying, how fully vaccinated am I with only one of the 2 shots received? She's prone to migraines and said she's worried that the side effects outweigh the risk of not getting that second dose.
Yeah, so you do not reach full quote unquote immunity, and I say quote unquote because it's not 100% efficacy until after you've received your second dose, again of the Pfizer, Moderna, or after Johnson & Johnson's one-time dose, until at least after 2 weeks of receiving your second vaccination. So again, the first dose, we cannot say that you have some. I'm sure you have some type of immunity, but it is not been studied and recommended for just a one-time dose for the Moderna or Pfizer. And then again, of course, with the Johnson & Johnson's, it's just a one-time vaccination. But again, after 2 weeks of receiving those vaccines, then have you reached the proper immunity needed to prevent the spread or contracting COVID.
And Dr. Brooke, what can you tell us about the role that vitamin D might play in protecting people from the COVID-19 virus? Is there any sort of truth to this?
So yeah, that's a good question, especially on the inpatient side. Treating COVID patients, we do, start some supplements, vitamin C, vitamin D, two of them. We also use zinc, but it also helps with the inflammatory properties that COVID seems to bring on, this inflammatory cascade. Now, I will say that there has not been any data to show that it prevents any morbidity or mortality, and preventing someone for having longer hospitalization or someone being ventilated, but is definitely something that you can use. Even if you aren't sick, it's definitely good to make sure that you're taking multivitamins and making sure that your immune system has some type of defense with different supplements.
And Dr. Brooke, we have another question for you that was just submitted live. Someone is curious, what are the recommendations for those with cystic fibrosis when it comes to getting the COVID-19 vaccine?
So it's similar to the first question you asked, people who suffer from, chronic lung conditions, cystic fibrosis being one of them, people who are immunosuppressants. There has not been any specific data that shows that they have any contraindication from having the COVID vaccine. But if you do have, again, reiterating any type of previous anaphylaxis, meaning life-threatening situation that may result from receiving any vaccine, or if you are concerned about a specific vaccine or have a question about one, to speak out to your primary care provider who can go over some of the different ingredients that are in the vaccines. Again, as previously mentioned in the beginning, there's a certain type of alcohol that's a component within Moderna and Pfizer that there's been known to have some type of anaphylaxis too, but again, it's very small. But if you've had any type of reaction to that specific ingredient, to definitely take caution.
Dr. Brooke, thank you. And Dr. Jerome, back to you. Mary wants to know, how soon will a vaccine be available to those who are younger than 16 years old?
That's a great question and very important, especially as we try to achieve herd immunity. So first of all, the Pfizer vaccine has been studied and indicated for those 16 and older, Moderna for those 18 and older. There are studies ongoing right now for those that are younger than 16 years of age, and the data appears to be promising. And I believe in a short period of time, there will be a submission for emergency use authorization. So as far as the time frame, I based on the data, I believe by the beginning of 2022, there should be availability of vaccines via EUA, so that those that are younger than 16 can be vaccinated or eligible for vaccination. They might be available as early as the fall in time for school, but should be definitely available by the beginning of 2022.
And another viewer asked, I heard there are other groups like white men, evangelicals, and military personnel who say they won't get the COVID-19 vaccine. Dr. Jerome, do you have any idea why that might be?
Well, as many of the panelists mentioned earlier, especially Felicia and Charisse, there are different cultural, different community barriers, different viewpoints of the vaccine. Specific to white evangelicals, there's been some concern about the government being involved, concern about institutions in general, the trust of institutions in general. And so just as with other groups, you have to meet folks where they are, right? You have to kind of understand what are some of the challenges they see and perceive, and address it really with fact-based information. No different from the African-American and Latina communities as well. We have to listen and understand and meet people where they are. But ultimately, it really boils down to sharing fact-based information, engaging with those leaders, those individuals in those specific communities that are trusted. I believe Felicia and Charisse shared that if you know someone in your particular community that you trust that received the vaccine, that is probably the most powerful driver for those individuals to get vaccinated. So really have to connect deeply with our white counterparts, our white brothers and sisters in the conservative community, so that we can achieve herd immunity, because it benefits all of us.
Dr. Jerome, thank you. Going back to Sharice now, our viewers would like to know where they can get information about vaccine distribution in their community.
Sure. So the North Carolina has a website called myspot.nc.gov. And so whether English or Spanish, you can change over the language and put in where you live, and you can actually put in the zip code, and you can do between 5 miles, 10, 25, and so forth. And they have various, and it'll tell you specifically if there's a Pfizer, Moderna, or Johnson & Johnson, and it has all the information on their website. So that's where I would start, myspot.nc.gov. Or for Latino population, if they wanted to talk to someone, they can call Camino Clinic at 704-596-5606.
Thank you. And finally, this last question is for both Sharice and Felicia. Cindy wants to know how best to talk to people who are hesitant to get vaccinated. So curious if both of you could just kind of speak to any suggestions about talking to family members or friends about getting the vaccine who may be either hesitant or just think it's not completely necessary.
Sure. I can try to broach that. It's a difficult one. I think Dr. Jerome kind of spoke on it. It's, we have seen, luckily, in the African-American and Black community where hesitancy was below 50%. As people began to see family members, pastors, community leaders, et cetera, getting the vaccine, the hesitancy in that, and our community has gone up to 25% or 75% of us are willing to get the vaccine now. That's great. I still have a sister that's, I have one sister is an epidemiologist up in New York, and she's got hers probably before anybody I knew because she worked with the medical center there. But then I have a sister who's not educated that way. She's educated, but not that way. And I suggest not fighting with the person and not getting into battles with people. I think just every time she comes to me for information, I calmly tell her, okay, that's incorrect. Please try this website, or this is the correct information, because I think people are reaching out to people to find out. I consider myself a health behavioralist. We have to continue putting the messages out there, communication messages. People watched President Biden last night. He's got in the camera real close and said, get your vaccination. We need it at the top, but we also need to tell our family members, our cousins, our sisters, okay, look at this. This is a good thing. This could possibly save your life. It will save possibly your community's life, our parents, our grandparents. So I think it's a way of being patient, speaking to people, especially when they come to you. And like we continue to say in public health, meeting people where they are. I was discussing it yesterday in the hairdresser with my hairdresser. People discuss this type of information with their barbers. So just giving people the information, providing it, being calm about it. It's nothing to really get in an argument about, but we continue to provide messaging and not to try to convince people, but just giving them evidence-based and good information.
Yeah, I agree with Dr. Jerome and Felicia's definitely, because like Felicia said, meeting people where they're at, continuing to address the underlying fear, the education, and those type of things, right? I can't just go out there with this million word document and expect someone to understand all of that, right? So I want to address their specific concerns, like, no, you don't need insurance. No, you don't have to have an ID. You just need to show up, and this is what this looks like. And for your specific condition, this is what may happen, and be honest, right? And then allow them to make an educated decision about their own health health and take that and own their health care, right? A lot of times we're forcing people to do things, and we already have that in our shame society and the external and all that. We, allowing people to make those decisions for themselves, why encouraging and showing them that this is the education and providing, like Felicia said, fact-based education, right? Well, you heard this on WhatsApp. Well, let's talk about that. Is there a chip? No, there's not a chip. Look at here. These are the things that we have as fact and all those, and really addressing their concerns and not taking any of it lightly. Or sometimes you may be like a chuckle and, oh, well, that sounds ridiculous, but this is someone's fear. This is someone's perception that we need to take very seriously, because this is their life, not mine, and be very cognizant and thoughtful about that.
Well, this has been a great conversation. That does conclude the Q&A portion of today's program. Thank you all for attending Community Connections presented by Novant Health. We hope that you found it very informative. And another special thanks to our panelists, Dr. Jerome Williams Jr., Dr. Brooke Williams, Sharice Johnson, and Felicia Fuller. Please remember to complete that survey that we mentioned at the beginning of this session. Your feedback is so important to us. And for more information on COVID-19 vaccines, feel free to visit novanthealth.org or the American Lung Association at lung.org. And a special thanks to Novant Health for serving as presenting sponsor of the Community Connections Speaker Series. Check your email later this afternoon or perhaps tomorrow for a recording of this session and some additional resources. Thank you all again for joining, and we hope you have a wonderful day.